If we've been hiding Dr. Gupta from the public. She's a hands-on health commissioner, so she's been very busy doing work on all of our behalf. So again, Doctor, thank you. So let's go over some data, and we'll touch on some points and then take some questions. Fortunately, we had no deaths in any hospitals over the last 24 hours, so we're very happy about that. We lost 109 people to COVID-19 in this process, and certainly, as we are here with Memorial Day weekend, we remember all of our heroes who have given the ultimate life, paid the ultimate price on behalf of our liberties, but we can remember them as well. I think it's important that we remember them and think about their families as well. Related to testing, we now have tested 29,424 individuals, 27,864. Remember when we were doing symptomatic testing and targeted proactive testing, our results were around 8% to 8.4%, our infection rates. Now we've opened it up. That's going to go down. We anticipate that. Over the last 3 days of our testing, we're going to look at 3-day averages moving forward because we've been increasing the testing so much. That we've had similar results over the last 3 days. From the ECLAIR system, the New York State Department of Health system, we've averaged 1,439 tests a day. Our positive infection rate over the last 3 days has been 3.2%. So as you can see, we were at 8 to 8.5. Now we're doing all this testing. Infection rate, that brings your total down to 6.4%. So we expect that to continue to happen. We will continue to do universal testing at the Syracuse Community Health Center on Salina Street next week. So again, anyone who wants to get tested can get tested. We had a great turnout yesterday at the Pastimes Athletic Club parking lot. We had the mobile testing site over there. We had over 210 people tested yesterday in that neighborhood. Very good day. Today we were at Dr. Weeks School. It seems like we're having equally strong turnout over at Dr. Weeks School. These are important parts of the community to neighborhoods that have a lot of our new American communities there. So we've been working with a lot of credible messengers in the new American community to try to get people there to get tested. So it seems like we're having some success. Next Wednesday, May 27th, we will be testing at Lafayette High School from 9 a.m. to 5 p.m. Online registration is currently available at our health department's website, ongov.net. Click on the health department and you can register. Again, we want to go into other parts of the community with our mobile testing, offer it up to people who maybe don't want to drive into the city, but also into areas where we haven't gotten a lot of testing done. So our southern towns, as we'll go over the data, not a lot of cases to date. Is that just because it's easier to physically distance, more rural towns, or are there different pockets that are there that we just don't know about? We'll find out. Again, I want to thank Chairman Dave Knapp for his help with Lafayette High School. Let's see, regional testing data. Remember our mandate, on average, 775 a day for Onondaga, Oswego, Cayuga, Cortland, and Madison counties. Yesterday we had a very good day of testing, 1,596 tests for the region yesterday, over double our mandate. Right now our average, 7-day average, 1,270. Good shape. We need to have high averages going into the Memorial Day weekend. because we don't anticipate a lot of testing to be done on Monday and Sunday. Let's look at hospitalizations, up 1 from yesterday, 83, not bad. Again, out of the 83, there are 40 individuals waiting to be discharged, no longer sick enough to be in a hospital, but with the new executive order over the last week, still trying to iron out what and when these folks can go back either to their homes or think of a plan B. Really, we have 43 individuals now in hospitals that are there because they need the support. We have 40 people that were there because they needed the support, and now they're waiting on being discharged. 19 individuals in critical condition, up a little bit from yesterday. We've had this range of 15 to 20 for about a month now. Let's think about these folks and pray for these folks, as they're certainly in need of help, and we want to get them better very quickly. Some data on those who are in the hospital right now: 53 Caucasian, 21 African American, 6 of another race, and 3 individuals have declined to share their information with us. To date, we've had 209 people that have been released from the hospital, meaning they got better, which is great. That's up 4 from yesterday. So again, we have a situation in our community where 2/3 of our cases now are related to senior facilities. These are folks that really have a tough time with the virus. There's a constant flow of these folks getting sick, going to the hospital, and then we then have folks that get better. And that part of that process is where we're getting this logjam. But we did have 4 other recoveries at the hospital yesterday as well. So looking at our cases, 1,788 cases, up 36 from yesterday. The asymptomatic cases now over the last 3 days are now 53% of our cases over the last 3 days were asymptomatic. Think about that. These are people that either were being tested, workers at nursing homes and assisted living facilities, or individuals who just wanted to get testing. They were curious, they wanted to, they weren't sick, and yet they've had some exposure to COVID. So we need to be very, very diligent in hand washing, certainly keeping 6 feet away from each other when we can, and if we're going to be within 6 feet of each other, wear a mask. This is what we know works in fighting this virus. People are healthy, or seem to be healthy, but still are contagious with this virus. And so that's really important. When you look at the 36, let's break out who they are. 7 household contacts, 17 related to seniors living facilities, whether nursing homes or assisted living facilities. So 24 out of the 36 are contacts and affiliations, 12 community spread. So good number for community spread today. Again, some of those folks asymptomatic, we never would have, under the old testing guidelines, never would have known about them. So proactive testing, doing the levels of it that we're finding these potential hidden pockets in the community, which is good because Dr. Gupta and all of her tracers get to find these folks, find their contacts, and quarantine them. We now have 1,784 people in the community in isolation or quarantine. Out of our cases, 1,061 have been female, 727 male, 71 under 19, 283 in their 20s, 219 in their 30s, 221 in their 40s, 285 in their 50s, 236 in their 60s, 184 in their 70s, 179 in their 80s, and 110 in their 90s. City of Syracuse, 976 total cases, 424 recoveries. Clay, 142 total cases, 102 recoveries. Onondaga, 129 cases, 34 recoveries. Geddes, 93 cases, 29 recoveries. Salina, 80 cases, 55 recoveries. Manly, 67 cases, 55 recoveries. DeWitt, 64 cases, 53 recoveries. Cicero, 60 cases, 35 recoveries. Camillus, 56 cases, 38 recoveries. Lysander, 34 cases, 27 recoveries. Pompey, 25 cases and 22 recoveries. Van Buren, 22 cases, 9 recoveries. Skaneateles, 15 cases, 15 recoveries. Marcellus, 7 cases, 5 recoveries. Lafayette, 5 cases, 3 recoveries. Atisco, 5 cases, 5 recoveries. And Elbridge, Fabius, Spafford, and Tully all have had 2 cases and 2 recoveries. Again, everybody's talking about it, but we're going to keep on talking about it because it works. And how we get through this process with this virus and fight it and continue to move on with phase 1 and phase 2 and phase 3 and phase 4 is to continue to stabilize the impact the virus is having on us. So we really need to reiterate the messaging of wearing a mask when you're with or within people. It's the right thing to do for your neighbors and yourself, even if you don't agree with that. Anytime someone's not wearing a mask, we hear about it because there's a level of anxiety. So even if you don't believe in wearing one, please wear one for your neighbors because it's something easy we can do, and it's the smart thing to do. Related to restart, we'll take questions on restart. Certainly tomorrow, nice day. We're going to have the beach open at Oneida Shores. The zoo will be open. These will be controlled settings, meeting capacity goals that we've put forward. Good opportunities to learn from slowly walking back into this process. Registrations will be certainly at the zoo. These registrations are important as we think about businesses and restart. Where you have a business, where you're providing a service, to register is important too, because that's something you're creating a record for contact tracing. And we'll talk more about that as we get into phase 2 and we start looking at phase 3 when restaurants and things will start to become open to the public again. But we can take other questions on restart. Again, our child care solutions, our daycare strategy for essential business employees, we're extending it through June. This will help alleviate some of the pressure on families for daycare. That phone number, 315-446-1220. Questions for myself and Dr. Gupta's.
Ryan, what advice would you give to people who want to go to Oneida Shores this weekend? 150 is not a huge number. It's better than 0, but I bet it will fill up pretty quickly.
Yeah, it will. So certainly, if that's how you want to spend your Saturday or your Sunday or your Monday, please get there early. And that's the reality. And if you don't want to be there the whole time, hang out for a couple hours and leave, and that means somebody else will get to enjoy it. But certainly, this is the reality with both facilities, and part of the reason why we know the weather is going to be nice, so we know people are going to get outside. We all know that there's certain parks that everybody likes to go to, so when you open up these other facilities, it actually de-densifies the recreational infrastructure in the community. So, we're doing things with our zoo. It's our park. That's why we can open it up when we want it to. In a way where we're going to be able to manage the situation. And then we're following the state guidance related to the beach at Oneida Shores.
Is there any kind of plan or process for a line forming, whether it's parked cars? Will there be, if it's at capacity, what do the people do who want to be the next in? Is there a process to wait?
Yeah, they're going to have to wait. And so certainly we'll see tomorrow if that's an issue or not. And then we'll learn from Saturday, and if there's best practices we can learn from that to implement Sunday and Monday, we will.
We were sent a picture yesterday from a cemetery in the town of Onondaga, a little bit distant away, but it looked like 40 or 50 so people very close together. You had mentioned the 53% is now asymptomatic. Does that just even reiterate what you've been saying, that these group gatherings cannot be at that type of level?
Shouldn't be more than 10 people in a gathering. And that's the rule. If you're within 6 feet, you should have a mask so you can put it on. If that's going to be the reality, we know enough about the virus that we know that these rules work. So the mass gatherings will be a situation where, and at some point, if we do well with the virus, a mass gathering isn't 10. It goes up, and I think we've talked about the rationale in phase 2. Maybe you increase that a little bit, and so that you learn and track data with more people being allowed to be together, instead of going from 10 to any number, right? So hopefully those recommendations will be considered, but we have cases where people get together and they think they're all healthy, and next thing you know, 2 or 3 of them are sick, and 15 and 20 of them are in a quarantine for 2 weeks. So being as close to this process as I have been this whole time, the one thing that I would not want to be in is in a quarantine if I'm not sick. And when you put yourself in a mass gathering, you are increasing the probability that that could happen to you. Because if you're in a quarantine, by law, you're in a quarantine for 2 weeks. If you get symptoms within that 2 weeks, guess what? Your number just went longer. So if you've been waiting to go back to work and you get that call and you go out and you hang out and you're doing things that pretty harmless, seems harmless, right? Hanging out with your friends, family, a nice barbecue. But you end up, our contact tracers find out who's there. You were there. You're in a quarantine. So don't put yourself in those positions. And we're getting there. We're making so much progress. We just got to keep reminding people this. It's repetitive. I know people probably get sick of hearing me and others say it, but it's working for us. It's working. We're in phase 1. Our community spread numbers barely moved up this week. Much better than what we thought would happen.
Have Dr. Gupta and her team seen that recently in terms of through contact tracing, noticing that, hey, there was definitely more?
Yeah, I think I'm referencing over the process, right? So we've been doing this for, I think, 9 or 10 weeks now. We've seen lots of things. So we know this happens, and we know what that can do. Dr. Gupta hasn't shared any stories this week with me besides the asymptomatic cases that they've been seeing.
Ryan, we are 1 week into phase 1. Are we still 1 week away from phase 2?
Yeah, absolutely.
So we're on track for phase 2 next Friday.
Absolutely. If you look at our overall data, our data's gotten better. The cases essentially have been tough to compare infection rates because the rules changed. But when you look at the community spread cases, it's tough to even compare those to previous weeks because we never would have. The previous weeks were symptomatic community spread cases, and those were now half of ours are asymptomatic. So we never would have even have known about these people. So as things change, the data changes. But our hospitalization rates, you take out the 40 out of the 82, our hospitalization numbers are better now than they were before we entered phase 1.
Phase 1 was kind of a scramble at the last minute. What do people need to do a week out to prepare for phase 2?
Yeah, we're pushing for state guidance earlier for businesses, and I know the state's working very hard to get that out so businesses can look at it. I think in we now have 737 businesses in the region that have attested online at New York Forward. I think in Onondaga County we're close to 550. So certainly as this guidance comes out, you need to go through that attestation process, just like the businesses in phase 1 did. So as soon as the guidance comes out, we encourage everyone to do that. So hopefully we'll get the guidance out earlier so that they can do that, and it will be a little bit more of a seamless process.
Ryan, what did the regional council discuss today, and did y'all make any decisions?
No, quick call. And again, I know, and I don't get to follow everybody's briefings each day. I don't get to see what the governor says each day and whatnot. But I look at a regional council, a group of advisory members getting together, aren't going to take the place of elected officials in communities. So I think that's kind of been, I don't know who's saying what. We get together, we share data, we communicate data, but that group's not going to tell me how to lead Onondaga County. And that group's not going to tell Chairman Hyder in Cortland County how to lead that, or Mayor Walsh, the city of Syracuse. So I don't want to say that these groups are I don't know how they are communicating every day by other elected officials, but what it is for us is we get to share with each other what we're seeing in the counties. So we were doing these calls before with all the counties before this group got together, and then we now have Director Driscoll on as a point person. We hear from Kelly Cummings and her team, the Director of State Operations, Colleen Deacon, giving us input on some of the new guidance that comes out. So it's a conversation.
And that's what I'm asking for.
Yeah, it's a conversation. So, but I think it's being reported that like that group, the decisions for the region, nobody's going to tell us how to make decisions in Onondaga County. That's what we're elected to do. So there's no body that's going to tell me how to run the county when the people of the county voted me in. So, but we went over the data. It was a very brief call today. Went over the data, and a couple updates that I think the governor gave in his briefing came on. I brought up I just saw a report right before about churches, with the president coming out deeming churches essential. I think that's something that we need to get a grip on quickly, because there's conflicting guidance between the state and federal government.
Did you have any update from the state about what to do with these folks who are in the hospital but could
There's not, they did not give an update onto it yet, which again, so right now my concern about the numbers as they speak now is that they are skewed and they're not accurate, so that can't be used as against any restart phase 2, phase 3, phase 4. It's not a capacity issue for our hospitals today. Now, if this is a problem going on weeks and weeks and weeks, it could become a capacity issue. So the state understands that that there's a situation that's not reflective of, we don't have 82 people who are sick in the hospital right now, or 83. We have 43, and that's actually, they understand that that's actually better than where we were when phase 1 started, when I think that number was like 53. So they've acknowledged this to me.
Who's paying their bills for these extra days?
Good question. I'm not sure how that works, but it's costing somebody money.
I mean, is Medicare going to reimburse that, you think?
I don't, that's out of my pay grade right there. I'm not sure how that's going to work out, but there is a cost for these folks being in the hospital, to your point.
If President Trump does override the governor about churches, how would you lead people of Onondaga County and lead churches in Onondaga County?
We've put forward a concept on churches similar to what we've talked about with reopening everything. Is phase 2, give more density, 25%, phase 3, 50, phase 4, you open it all up. That would be the same guidance that we think should happen regardless. We think we can do that safely now, whether it's the state or federal government. Going from 0 to full capacity probably isn't the smartest thing to do. Do it in phases. I think I had a conversation with the bishop today. I talked to other clergy. So I think this is something we need to do. We need to get this done and do it in a safe way where there's really good communication so everybody understands the rules.
Do you feel that there's not good communication on that topic right now?
Well, I think there's conflicting communication now, so this will be a challenge that we have to get worked out quickly.
Will the planning of reopening Destiny USA look any different given the layout and just close proximity where you have different businesses a part of different phase-ins? So say you're a business that on paper is phase 3, but you're in Destiny. Could you see any a delay in that?
So Destiny has come up with a plan. I think Dr. Gupta has looked at it. I haven't seen it yet. Part of those businesses in phase 2 are going to be able to be open. Some of those businesses won't be able to. Remember, in the beginning of this process, when we were going through a series of shutdowns. The mall actually was towards the end of the shutdowns because you can make the argument very easily that you can easily be 6 feet apart in the mall. And where you certainly have a harder time making that argument in a grocery store or a supermarket. So we shut down the mall because we were concerned schools got shut down, and then we were concerned about teens potentially going to the mall, hanging out in groups, and creating, this was also new, so to kind of police that was logistically very difficult. So we shut down the mall then. And so now as it reopens, some businesses will be, we've said, we're going to let the phases dictate how the mall opens up. And so the retail will be opened up in phase 2, the retail stores. The restaurants and the entertainment won't be. So part of the protocols that Dr. Gupta's team is going to review and the recommendations they make, we expect that the operator of the mall will implement those as there will be more people going through those stores. But I don't know how that's going to work, though, as far as the stores opening up. Will they all of them open up? Because I don't know how many people are going to go. And, you know, do you open up if you don't know what kind of traffic you're going to have or not? So we'll find out soon.
Ryan, would you yield to the president or the governor on churches?
I don't know right now how to address that conversation because it's all so new. I think we can open up churches more than 10 people.
It sounds like they're both on an extreme side. The president wants to go 100. The governor's at 10 people right now.
Yeah, I think the governor too is talking about a group of people giving some feedback. You know, hearing directly from some of these parishes and some of these churches and synagogues and mosques. So certainly we know where the president is, but I think we need to. This is an issue now we got to figure out. We can't wait a week or two because nobody is going to want to go send police into a building during a prayer service and try to enforce social distancing. The troopers won't want to do that. The sheriffs won't want to do that. SPD's not going to want to do that. So we got to figure out what we're doing and give good communication.
Dr. Gupta, when you look at that number of 53% asymptomatic, what do you think and what do people at home need to know?
So asymptomatic cases are a concern to us quite a bit because we don't know how many us could have it, right? So you're going somewhere in a gathering and that's those 52% in last 3 days average, which we were able to see, that raises a concern that what is the rate of transmission by these individuals who are not having obvious symptoms and they may be among ourselves. So yes, we are very concerned as a public health, as a physician, and as a member of the community. And that's why it is so important to have those processes still in place, which has gotten us to this point that we are able to open the community. It means you have to make sure you follow that social distancing, you wear the mask, to respect others, make it a fashion statement, that's okay. It makes the social norm, it's important, right? I walk with my mask and it just has become a normal thing when we talk to each other. Sometimes you have to say, oh, I'm wearing mask still, it kind of feels weird if you don't wear it. So if we, and also washing hands, staying home if you're sick, a lot of those things are so even more important when we are talking about asymptomatic individual. So what my message to will be is, I think, is recipe, right? Recipe for successful long holiday weekend when you're thinking of asymptomatic. Then hopefully all of you can follow. If you have a summer fever and you want to hang out with your some extended family and friends and want to enjoy the beach or something that's going to be open, most of the time I would say try to stay home. And outdoor is better instead of in house. You can walk your dog, you can jog, you can grill. Grilling is out there. I have to clean up my grill now and then try to think of that. Gardening is good, and simply hang out, just to have a good time. No large gatherings, as County Executive has mentioned. Social distancing should be a new norm, right? And hand washing is the cool and smart thing. That is something we should be proud of that. That's not thinking, oh, we are not And face covering is the statement of respect to others. That is so, so important that I can't emphasize that for the, especially when you're thinking of asymptomatic cases who could be around, and if both of you are wearing mask, that actually protects to some extent. With the face covering with the cloth, it's not that good as surgical mask, we get that, but it's better than nothing. It actually, if you have a double cotton covering, that helps significantly. So I would strongly recommend that.
Have you been tested?
I have not been tested. But certainly if there is any, yes, it's a good question. It is a good question that should I be tested? I never thought about that because I have been feeling good. But again, you're talking asymptomatic, right? That I have not been tested.
Have you personally tested anyone?
I have personally, no, I have not tested. You mean put the PPE and all? No, I have not done that.
Doesn't seem
because
enjoyable
I attempted
from
to
the
do that,
testing
and people
either.
actually told me just we have a lot of people for you to do this work.
You're very strict on patient privacy, as you should and as you've sworn by, but are there any patterns, anything new about the newer cases that you're seeing? People doing something they shouldn't? Any lessons we can learn from the past few weeks of where the new cases are coming from?
Right, so we are seeing sometimes the family members, they are testing more, there's more testing available now. So we have group of family members who are not contacts of anything. They're all tested together, and a bunch of them are asymptomatic. So that's concerning. That's what the question goes back to answer goes back to what you were asking. We are also seeing people are still hanging out in the way they shouldn't be. They're not wearing masks. They're still going to the places when they have when they shouldn't be. They are going to work at times where they shouldn't be, so they expose other people. So these are the patterns we have continued to see, unfortunately. But at the same time, we have been very proud of some people who really separated themselves so good and then just feel like that's really good. And then when we test the other person for some other reason, they remain negative. So these things do work. And these are proven records.
What do you make of the CDC's change in guidance that the virus is not as transmissible on a surface
Right.
as it was initially thought? Because I've personally spent a fortune in Lysol wipes, and maybe I didn't need to.
Right. So again, this is a moving target, a science. I would still say that people really should take it seriously, making sure cleaning surfaces is a good for any other ways on hygiene. You have other bacteria too, other viruses too. And so I would not change the habit at this point to do what you have been doing, because that will prevent in fall, if you continue this practice, it will prevent common cold. It will prevent flu, right? So hopefully we'll have a better outcome when we go into the flu season. And when we are going to be worried about COVID at the same time. These are the things which we need to be prepared. So that's very crucial.
Are there extra hand washing stations at the zoo and at the parks that are open now?
Yes. Yes.
Ryan, when we were here a few weeks ago and it was on the eve of Easter, you made a point of saying that you were going to have a small celebration at home with your kids and your wife. What are your plans for Memorial Day? Has that gotten a little bit bigger?
No, probably not. We'll continue to. I let my son Jack, in full disclosure, ride his bike in the neighborhood yesterday with a mask on. That's the first time he's been off, essentially, our real estate. So I apologize to the neighbors if he was riding his bike too fast, but we'll probably hang around. If we're gonna see my parents or anything. And again, I've talked about this, and everybody should. It's not so much probably you that gets sick; it's the person that you love. My parents have had some pre-existing medical conditions, so we're very cognizant of when we're together with them, and as hard it is for them not to hug and kiss my kids, it's probably not the best idea for them to do that. So until we get through this and we know more about the virus, these are the types of things we got to do. So hopefully maybe I'll see my parents, and maybe we'll hang out in the backyard, social distancing, and maybe have some dinner. I'm not sure, but we won't be doing much. I will be tomorrow. I'm certainly going to be myself going to see how things are going out at Oneida Shores and the zoo, around the community, see how things are going so I can see it for myself, so I'm comfortable with the decisions that I've made to date.
You've said at previous briefings that you don't have your own police force, but in your conversations with the sheriff, the city police, and the other village and town officers, are any agencies doing anything special this weekend in terms of upping patrols, having social distancing, observation happening by officers? Because if there's any risk for social distancing between the weather and the season, it's this weekend.
Yeah, I think I know that the law enforcement agencies beef up anyways for issues like drunk driving and other things. So I think you'll see more law enforcement out, and I'm confident that they'll do the right thing. And you know, these folks have families as well, and they are prone and susceptible to infection as well. We're going to do testing of our law enforcement, of our sheriff deputies, as well as our inmates at the prisons as well. So that these are things that, you know, everybody can get this. Okay, it's how our body handles it. Folks who are asymptomatic, their body has handled it pretty well, but they're still contagious. And so until you know, and that's what I think is very scary about this now, is we're seeing quite a few people who have been exposed, and who, it's good for them. They've handled it well. They didn't get sick, but what about their loved ones?
And 911 is still the number to call if people see people not social distancing?
Physical mass gatherings, yeah. Yep.
Syracuse police said today that they've fielded 610 police calls on social distancing violations, 85 business, and 525 public and social gathering. I know that's been over the last 2 months, and it seems like a high number, but to you, does that also mean that we have people in the community that are going to be like, I don't think so, I'm making this call?
Yeah, I think people take it seriously, and a lot of those calls, I'm sure, were moment in time scenarios. You have people walking down the street, walking by each other. Maybe they say hi for a couple minutes and keep walking. But certainly there's folks in the community that you know, don't follow the rules all the time. It's always been the case with every rule. I'm not suggesting any of you didn't follow all the rules while you were growing up, but I'm sure there are a couple times. I'll ask Andrew's mother about this at some point. But that's just the reality. And so that's why we have law enforcement to go out, do the right things. SPD's done a great job breaking up some of these scenarios where people are putting themselves in a position, you know, for more risk. And so we got a lot of people following the rules, or else we wouldn't be where we are today. That's the good news.
Where would you draw the line on gatherings this weekend?
Yeah, we have park rangers in our parks, so once you're there, we're not going to let these things get out of control because it's not safe. And so we'll have people at our beaches, we'll have people at our parks. We expect our parks to be busy this weekend, and as they should be. It's going to be great weather. But people just need to let's use some common sense. And when you ask, and this is what I would ask too, many people who talk about restart in business say, use some common sense. If we can do it smart and safely, use some common sense. Open it up a little bit this way if you can do it safely. Good point. I agree. Like, let's use common sense to get when we're out together as well. So I think government can use some more common sense in how we look at this and the risk, and certainly we need the public to use common sense. You know, put yourself in positions for you and your family to enjoy yourself, enjoy loved ones, but do it in a safe way.
You mentioned testing inmates. Have there been any confirmed cases in the jail or among sheriff's deputies?
No. I'm not sure on all the deputies, but we have no cases in the jail. We're going to test in the jails, I think, next week, and we're going to test the deputies and any of our vendors who might be in and out of the Justice Center or Jamesville. Same concept. We don't want people getting sick who are in dense areas. So proactive testing, that's what we're going to do for that situation.
What about at Hillside?
Hillside, not our program, but if anybody wants, one of the things we'll do, if anybody wants us to, Hillbrook might be what you're thinking.
Sorry.
Yes, okay. Yeah, we would, yeah, so smaller number of young people, but certainly we'll do that too. We'd probably have to look at the rules. It's all voluntary with our inmates, but we'll look at those rules. But the same concept. We'll look at that, and we've had different groups like Hillside and different groups with that have asked us potentially to go test in their facilities, and that's what we'll do. We have the capacity. We'll set it up. We'll get it done. We'll do it.
We imagine you'll be getting a few moments of rest yourself this weekend with your family. What is the one call that you're dreading getting on your phone while you're with your family about something happening in the county?
So that call usually comes from one person and one person only. She's in the room today. Her name's Ann Rooney. So whenever I see her name on a caller ID at night or on a weekend, 9 out of 10 times it's something that I don't want to hear. And she knows it, so we laugh about that. But yeah, there's a lot that happens in government, non-COVID related, that we're responsible for. So there's lots of things you don't want to see happen. A lot can go wrong when you run a government the size of ours. But certainly, each day we'll continue to get the data out. We're going to do a briefing tomorrow, and then Sunday and Monday we're going to take off.
But there's risk this weekend.
So yeah, there's a lot of risk, and we'll be working, and we'll hear about it, and the parks and stuff. But you don't know the virus. You don't know about it for 5 or 7 days after. So we'll know 5 days later if there's people getting sick 3 days after Sunday or Monday, and they get a test, and then 2 days later we get the results. So you'll hear about crowded gatherings, but whether or not that meant people got sick and the spread went further than it would have, we won't know for a little while.
Our numbers look really good right now, looking toward phase 2, but could people's actions in the next 72 hours derail that?
Probably not into phase 2, Terry, but I think phase 2 is really the challenge. When you look at really bringing back the density, phase 2 is a big test. Your downtowns will be alive a little bit, and you'll see more interaction. And if at the end of this process there's something we don't know, we'll find out week 1 of phase 2, right? So again, this is something that I think everybody, for the most part, wants to keep moving through this process and do it in a way that where we're doing it safely. So we can't do it, really. The community needs to want to do it. And so if you want to get to phase 2, which haircuts, I believe, are in phase 2, that's an important thing for a lot of people. I hear about it. Trisha's laughing. I was joking about this earlier, but the mullet really had a long period of time in the 80s and the early 90s, and the mullet is making a comeback during this pandemic. But if we want to avoid these things, we got to get to phase 2. It means we got to be smart. And then everybody's going to want to get to phase 3. It's going to get harder from phase 2 to phase 3 because we're going to be together more. So we got to just be very, very cognizant. And then phase 4, once you get to phase 4, you get a little bit of things back where they were. And at that time, we'll have, hopefully more information on how strong the virus is and what the threats are, and the doctors will be able to communicate with us all the things they're learning. So we got to just keep doing what we know works.
We'd know the results, though, of this long weekend's spread before we get to phase 2. Or would you?
No.
If there's a problem this weekend,
when
would
you look
feel
at the
safe
data,
in phase 2?
Yeah, how are we gonna? If you're doing, so what stops you from phase 2? It's your only thing that would stop you is if you had a huge uptick in hospitalizations. New cases, we probably wouldn't know new cases in a way that is valuable unless we had a 3 to 5 day average. So what we do today, we won't really see the effects of 5 to 7 days from now. So, next Friday is phase 2. So from a case standpoint, there's nothing you can really do as far as infection rates that will probably jeopardize that. But the more cases you get, depending on who gets sick, puts pressure on hospitalizations. And that's where every community in every region, that's where it can slow things down, is hospitalizations getting to the point where your capacity, because remember, the hospitals serve more than COVID patients. So that's the risk. And so how do you keep hospitalizations low? You know, stay 6 feet apart, wear a mask if you're going to be within that, and that should keep cases lower, and that's how it all works. Other questions? Okay, let me talk about this. The One New York run. Some of this material is not my own, so if you don't like the material I'm about to read to you, blame Justin. We all know the phrase, the freshman 15 from college. We have often heard this phrase, quarantine 15. This is related to people being in quarantine and potentially not getting as much exercise, but being stressed out and eating a lot of bad food. Today, I'm happy to share with you a way to help potentially lose some of the quarantine 15. Leone Timing and Results has partnered with the Fleet Feet Syracuse, two great local companies, to launch a virtual challenge to help us get us up and moving safely throughout the summer. It's called One New York, and it's a virtual foot race from Buffalo to Long Island, which is approximately 1,000 miles. You have until August 31st to compete the challenge, and you even get some swag for competing the challenge. To date, over 11,500 people have registered. The best part about this is that the proceeds are being donated to directrelief.org to buy critical PPE for our frontline workers across the country. Already, over $67,000 has been donated. So folks can find out more at www.oneychallenge.com. Again, it looks like you owe everybody 1,000 miles.
It's 1,000 kilometers.
1,000 kilometers, not miles?
Yeah.
Again, like what did we say, Terry? Blame Justin. 1,000 kilometers. So how many miles is that? 1.6? That's it?
No, it's like 600.
Okay.
15 kilometers isn't,
20 miles from Buffalo to the end of Long
Okay.
Island. The other was like 300.
based on the Boilermaker, 15 kilometers
Wow,
is
okay.
9.3 miles.
So it's a lot of exercise. Is that what we all can
Long
agree on?
time.
Okay.
Are you doing it, Ryan?
I doubt it.
You can also
But
do
let's,
you can also do Buffalo to Albany, which is 500K.
I might be able to do that one. I don't know if I'm going to have enough time to do this. If we can get through this virus together, we'll be able to get this done. But it's a fun way to try to get back into shape as the weather gets nicer, and it's it's good public health, and it's nice to talk about these kind of things. So we will see you tomorrow, but please enjoy everything, the weather, do it in a safe way, and we'll see you tomorrow. Thank you.